What kind of doctor is the best for treating scoliosis? Now, if you or your child have been diagnosed with scoliosis, it can feel overwhelming trying to navigate, the range of treatment options and determining the best path forward. You might be wondering what kind of doctor is best for scoliosis, or, how do I know which treatments are the most effective? Hi, I'm Dr. Chris Gubbels with ScolioCare Denver, and in this video, I'm going to guide you through different scoliosis treatment options and help you make an informed decision for you or your child's scoliosis. Now, as I'm going through this, if you like this content, be sure to give us a thumbs up. Now, scoliosis is a three-dimensional spinal condition characterized by a lateral bending of the spine of at least 10 degrees, and it must be accompanied with spinal rotation. It can occur at any age, and with adolescent idiopathic scoliosis being the most common type. Now, other forms of scoliosis include congenital scoliosis, neuromuscular scoliosis, and degenerative scoliosis. And degenerative scoliosis is a scoliosis that actually affects adults. Now, the severity of scoliosis is often measured on what we call Cobb angle of measurement. A mild scoliosis is a curve that's under 20 degrees. Moderate scoliosis is curves between 20 and 40 degrees. And severe scoliosis is curves that have gotten beyond 40 degrees. Now, the best treatment approach depends on the type and the severity of scoliosis, the patient's bone age, and other individual factors. Now, let's explore the specialists who can actually help and provide effective treatments for scoliosis. There are different types of doctors involved in scoliosis care. Orthopedic surgeons really specialize in diagnosing and treating musculoskeletal conditions, including scoliosis. They're often involved in monitoring scoliosis progression and performing surgery for more severe cases. Scoliosis rehabilitation therapists, such as physical therapists or exercise physiologists, train in scoliosis-specific exercises such as scolibound, Schroth, or C's, play a crucial role in non-surgical treatment. Now, these specialists help patients improve posture and alignment, strength, stability, and balance. Now, some chiropractors have specialized training in scoliosis, and they have experience in scoliosis bracing and scoliosis-specific exercise. Now, while traditional chiropractic care is not a primary treatment, chiropractic adjustments can provide pain relief and increase spine mobility. Now, most chiropractors that actually specialize in scoliosis come from a chiropractic biophysics or CPP background or a clear background, and then they do advanced training in scoliosis bracing and scoliosis-specific rehabilitation and scoliosis specialty clinics. Now, some clinics focus exclusively on scoliosis, and they offer a multidisciplinary approach that actually includes or follows SOSUR compliant guidelines. Now, these specialists are often well-versed in non-surgical treatments like bracing and scoliosis-specific exercises, and ScolioCare has scoliosis specialty clinics around the world that focus exclusively on providing custom bracing and rehabilitation for scoliosis and hyperkyphosis. Now, let's explore some of the different treatment options based on the severity of the curve size. Observation is often recommended for mild curves, especially in growing children. Now, during observation, we want to do regular checkups to see if the curve is progressing or if it's worsening. When we do observation, x-rays are typically taken every 6 months. And both standing and sitting height should also be measured to assess skeletal and bone growth rate. Observation is ideal for curves that are under 20 degrees in people that are still growing. And while observation alone doesn't actively correct scoliosis, it does allow for timely intervention if the curve progresses. Observation is different than just watch and wait, which watch and wait is basically when a provider says, go home, let us know if anything progresses. Observation involves active observation and regular scheduled checkups. Now, scoliosis-specific exercise, like those taught in the ScolioBalance program, are a cornerstone to all non-surgical treatments for scoliosis. These exercises are really personalized to the patient's individual curve pattern and are designed to improve spinal alignment, enhance postural awareness and posture balance, and strengthen spinal muscles to help stabilize the spine. They are also there and designed to help reduce pain and discomfort and allow people to increase their activities of daily living. There are 4 criteria that have been established by SOSUR for a rehabilitation program to be considered a scoliosis-specific exercise program. 1, it must teach the patient how to put their spine in a 3-dimensional corrected or overcorrected position. 2, it must include strengthening and stabilization in a corrected position. 3, it must incorporate activities of daily living, teaching the patient how to hold their spine in a correct position while doing normal activities of daily living, things they already do in their everyday life. And 4, education. The patient must fully understand what is happening to their spine and what they can do to actively be involved in an effective treatment program. Now, SOSORT stands for the International Society on Scoliosis, Orthopedic, and Rehabilitation Treatment, and guidelines established by SOSORT strongly endorse scoliosis-specific exercise as an effective intervention for mild to moderate curves. Now, scoliosis-specific exercises are ideal for small curves on their own, curves lower than 20 degrees, and they're recommended in combination with bracing to moderate and severe curves. And it can also be done before and after surgery for surgical cases. Now let's look at bracing. Bracing is a proven method for preventing curve progression and reducing scoliosis curves in adolescents that are still growing and their curves are progressing. Now, the Scoli brace is one of the most effective and most advanced braces available. It offers a true 3-dimensional designed brace tailored to each patient's individual curvature. And unlike traditional braces, the Scoli brace actually promotes spinal correction and not just trying to stabilize in hopes that we reduce curve progression. Now, in infants, in juveniles, and adolescents, the goals are really to prevent curve progression, reduce curve size, improve aesthetic or physical appearance, and also reduce pain. In adults with degenerative scoliosis, the goals are to reduce pain, improve activities of daily living, and really slow down or stop the progression. Now, some adults that have more flexible spines may also be able to get some correction with custom bracing. Now, the key benefits of bracing though are really to halt or slow curve progression, potentially reduce the curve size, allow for improvement in posture and function, and improved aesthetic and physical appearance, and really reducing pain. Now, bracing is ideal for curves between 20 and 45 degrees in children or teenagers that are still growing. And it can be used in patients between 45 and 60 degrees who have utterly rejected surgery. It's also used in adults that have scoliosis and pain or have a progressive degenerative scoliosis. Once someone reaches beyond 45, they become a candidate for surgery. But just because someone's curve has gotten beyond 45 degrees doesn't mean they have to have surgery. Now, there is evidence to support non-surgical treatment options for curves up to 60 degrees in individuals that have actually utterly rejected surgery. Now, surgery becomes an option for severe curves exceeding that 45 to 50 degree mark, especially those that are causing pain, people that are having breathing difficulties or functional limitations. Surgery may be necessary. Now, spinal fusion is the most common procedure where the curved portion of the spine is actually fused using rods and screws and bone grafts. And tethering is a non-fusion surgical option that may be used in growing adolescents who have not responded to scoliosis-specific exercise or bracing or have rejected those treatments. And there's different things that surgeons will look at to determine if someone may or may not be a candidate for tethering. And then some evidence shows that tethering is still experimental, and we don't, and the jury is still out on whether this is the most effective treatment for different types of scoliosis. Now, while surgery can effectively correct significant curves, it's generally considered a last resort due to the risk and recovery time involved. Also, it should really only be considered when conservative treatment options have failed. It's ideally used on curves beyond 45 degrees or in patients with progressive degenerative scoliosis that have not responded to non-surgical treatment options. And like I said, while surgery can effectively correct curves, like bigger curves, it's generally considered a last resort due to the risk involved. Now, one more scoliosis we want to look at is degenerative scoliosis. This typically affects adults that are older in age, and it could be someone that had a curve when they were an adolescent or juvenile that is progressing in adult, or it could be a new scoliosis that actually develops in adulthood called de novo scoliosis. Now, there's different potential treatment options for managing degenerative scoliosis. Now, these treatment options include scoliosis-specific exercises for strengthening core and back muscles and alleviating pain and improving stability. Bracing, like custom bracing for scoliosis. This can be effective for adults with degenerative scoliosis with the primary focus at reducing pain, stopping or slowing progression, and improving overall activities of daily living. There was actually a retrospective review that was published in the Archives of Physical Medicine and Rehabilitation, and it found that wearing a custom low-profile brace for 4 to 6 hours a day could dramatically slow or stop curve progression. And in some cases, those curves even improved. Now, Dr. Jeb McAvinney did a systematic review where they found evidence suggests that spinal bracing treatment may have a positive influence on pain and function in adults with progressive degenerative scoliosis or adults with degenerative de novo scoliosis. Now, one treatment that is frequently used in the United States is epidural or facet joint injections. Now, steroid injections, they may reduce nerve irritation caused by scoliosis and provide some short-term relief, but repeated steroid injections can actually cause a catabolic effect and cause the joints and ligaments to further degenerate and further accelerate the progressive degeneration of scoliosis in adults. And surgery in advanced cases may be needed when all non-surgical treatment options have failed. Now, let's look at some supplemental treatments for scoliosis. In addition to primary treatments, there are several complementary therapies that can really enhance the overall well-being and symptomatic management. Chiropractic adjustments, they can help improve spinal mobility and alleviate discomfort. And while it's not a standalone treatment, chiropractic care can be a valuable supplement to massage therapy. Massage can reduce muscle tension, it can improve circulation, and it can relieve pain associated with scoliosis. It's particularly helpful for managing stress and just improving overall quality of life. Like yoga and Pilates, now these both emphasize core strength, flexibility, and postural alignment. Now, you may have to modify the practices to tailor more towards someone's scoliosis and also to make sure you're not doing any movements that could potentially enhance the scoliosis. And then nutrition and lifestyle. Nutrition and lifestyle also plays an important role in scoliosis management. Having a good diet, a low inflammatory diet that helps you maintain a healthy weight can have a positive impact on scoliosis management. Staying active, prioritizing overall health can also play a significant role in treatments. Possibly the most important factor in treating your scoliosis is getting the right scoliosis team. You got to find the right doctor and the treatment team, and it's crucial for your overall success. Now, make sure you look for a specialist who has actual experience with scoliosis-specific treatments, such as scoliosis-specific exercises and custom bracing. Look for someone who follows evidence-based guidelines such as those that are established by SOSORT, and also someone that offers a multidisciplinary approach, including both scoliosis-specific exercise and bracing. Scoliosis can be a challenging diagnosis, but there are effective options to help you manage it and improve your overall condition. From observation to advanced bracing and scoliosis-specific exercise, non-surgical treatments offer real hope for many patients. And even in severe cases, surgical advancements continue to progress and outcomes get better and better all the time. Now at ScolioCare, we preach the right treatment at the right time. Now ScolioCare is a world-leading authority in the non-surgical treatment of scoliosis and hyperkyphosis. All of our treatments follow guidelines that are actually been established by SOSORT. If you may be a candidate for our treatment options, click on the link below and request a free discovery call. And on that discovery call, we'll get a chance to review your case and what your potential treatment options are. And if you found this information helpful, be sure to hit that subscribe button so you can be notified when we release new content on treating scoliosis. Now with the right care team, a proactive approach, and the commitment to treatment, you can achieve meaningful results. Remember, scoliosis is a journey, and you don't have to face it alone. Reach out to ScolioCare Denver, take the next step towards your better spinal health.